Shri Mahakal. So today we have a patient from UK. Let's hear from her how is her experience with us at Sai Holistic Dental Care. Hello,
Hello,
Shri Mahakal.
Shri mahakal.
So
I just want to say that I asked Dr. Dev to do this because I know a lot of people think that people are, given a script what to say or whatever. But I can only say that my experience here has been absolutely brilliant. I had really, really awful teeth. In fact, I've only got 16 left now. There's 8 at the top and the bottom of the front. So I've had 4 big surgeries, top and bottom, all my molars basically, which consisted of extractions, cavitations, both sometimes. I had 2 at the bottom, which I had milk teeth in, and I kept them until I was probably about 50 plus. But obviously there was no adult teeth to come through from them. But when Dr. Dev looked at those, they were really, really deep cavitations, particularly the one on this side. And he actually showed me by putting his dental instrument into the cavitation to see how deep it was. He pulled out pus-filled roots with cysts on. They were in a dreadful state. I wouldn't have envied him doing my teeth. I'm just trying to think what else to say because, this is really, really out of my comfort zone, but I wanted to do it to show my appreciation to Dr. Dev, for what he's done for my teeth. Not just my teeth either. He has looked at other health issues for me, which I'm happy about. And I think he's going to send me home with some homeopathic stuff as well. And of course, once I get home, the detox will continue and to continue my health journey. Whilst here, I've been lucky enough to experience the Holy Festival. Was taken down the road to enjoy and partake of that, which was really nice. And we really are made to feel kind of part of the family. I've got a lovely room above, 2 floors above the surgery, where I can walk out to the sunshine, exercise. Dr. Dev has shown me some yoga because I haven't done yoga before, so that's something else for me to work on when I get home. Meditation, that's another thing. And of course I can't forget Rikita, Dr. Dev's wife, who does such lovely fresh organic food. I mean, it is gorgeous, and I actually think she should write a cookbook so that I can take it home with me and continue doing it. I don't know what else I can say, really. I mean, it really is an experience to come. I've never known anybody else like Dr. Dev. He's more than a dentist. He does, offer a lot more. Now, I can't say it's all pain-free because I had 4 big surgeries, and one in particular wasn't good. But I was determined that I didn't want to take any pharma drugs, so I did feel pain through that one, but with IVs and things. And Dr. Dev's wife was looking after me that evening as well, which I'm very grateful for. So yeah, it's. But then I don't suppose you expect to get teeth extracted or cavitations done without an element of pain, do you? So, Dr. Dev, can you tell everybody else as well, because obviously from a dentist point of view you can give more detail into the actual work you did do for me, which was huge.
Yeah, thank you very much for choosing us, for trusting us.
Yeah.
You came a long way from your country to this country. Thank you again.
UK, from the UK.
Yeah. So you had an awful mouth when you came. I'm so sorry to say that. Yeah.
You're right.
We had all the 4 deep surgeries. I would say you had so many cavitations from all the quadrants, left, right, upper, lower. So we did all the root canal extractions, cavitation surgeries, and all the root systems. Those were first filled. So everything went to be a very deep surgery.
Yeah.
It was not a superficial in any of the quadrant.
You showed me, didn't
Yeah,
you?
I
Because
showed you.
I
Yeah.
wanted to see. So Dr. Dev gave me a mirror so I could
Yeah.
actually see. You know, everybody perhaps don't want to
Yeah.
do that, but
Yeah.
I did.
Yeah, you were so brave to see every nick and bits of the surgery. I made it a point that you see
Yeah.
and you understand that.
Yeah. What you actually
Yeah,
were
what I'm
dealing
doing.
with.
Yeah,
The other thing is, of course, that because a lot of people that come from abroad here have only got limited time.
yeah,
You have to do a concentrated
Yeah.
amount of surgery, and because I had such a lot,
yeah,
you were doing 3 or 4 teeth
yeah.
a time, weren't
Yeah.
you? Which is big, isn't it?
It's a very big. Yeah.
Yeah, yeah,
So all the means four sockets this side we were dealing, 4 this side, 4 here, 4 here. So it was quite a big surgery and the healing was quite good. But yes, the surgeries were not painful. I feel means while we are doing the surgeries, was it paining to you?
no.
So while doing the surgeries, it was not paining, but after the surgery, when it's a healing time,
I had 4 big surgeries,
Yeah.
and I think it was the 4th.
only the 4th one pained.
Yeah, yeah,
The 1, 2, 3, all the surgeries were quite good.
yeah.
But the 4th one, the pained you, and it was quite
I mean, the
tremendous.
surgery was okay on the 4th. It was just the pain.
Pain afterwards.
Yeah, because Dr. Dev gives you 2 sets of pills afterwards, homeopathic pills, which you have to take every 5 minutes, as soon as you've had the surgery. So I was doing that, and you know, they worked through all 3 of them. It's just the 4th one that I had trouble with, didn't I? And then I found that I needed, I had to have 2 more IVs in the end because you know, it really did affect me. But you know, I think if you come in somewhere, you can't expect to have no pain, you know, and I wanted to go the homeopathic route as well. So I was kind of determined that I didn't want to take any big pharma drugs or antibiotics.
So we didn't give you any pharma
then
drugs.
have to detox, wouldn't I?
Yeah, then you have to again detox for new things.
Yeah, exactly. I don't need any more. Yeah.
So no pharma drugs were used.
No.
But in the last years, the surgery which we did on this quadrant, after the surgery, it pained for some time, and we managed it with IVs and whatever stuff we have, but we didn't give you any painkiller, and you also didn't want to take any painkiller and the pharma drugs.
I didn't know.
But all the three quadrant surgeries didn't pain, but the last one pained.
Yeah. And now I have my complete set of dentures.
Yes.
So,
and the surgery didn't pain. I'm so sorry. The post-surgery surgery were pain free. Some of the patient might have said that it was painful surgeries to some of the reviews, but
I just think you can't. I don't think you can expect not to have any pain. I mean, some people. I mean, of all my 4 surgeries, there was one in particular. I took the pills like every 5 minutes, as I did for all of them, and I just found I didn't really need much of them at all, because that one was. It just depends, doesn't it? So.
So what I could feel was the reason that all the 3 were already healing.
Yeah.
They were not completely healed. They were already healing, and we did a new surgery because shortage of the time. We have a limited time.
It's a lot on your body, isn't it?
Lot on the body to suffer, and not on the body to recover.
Yeah, I also felt that the 4th one, though, it felt deeper.
Yeah, it
right
was
from
quite
the
deeper.
start.
Yeah.
It was, you know, one at the back here, and then it felt quite even, you know.
Yeah, very deep. Yeah. It was a hole inside your bone, which I showed you. It's a deep hole and deep broad hole.
Yeah.
That was not healing since I think maybe from your adulthood, or 20s or 30s.
Yeah.
So it was quite a big hole, so it had to take some time healing, and healing is sometimes it's painful, sometimes it's not. But we try to manage it as good as possible.
We did. I just, you know, I mean, as an honest, you know, report of what's happened here, it's just, you know, I'm really, really happy with my dentures.
Yeah, she's having all the dentures now.
Yeah, I mean,
so you are able to chew perfectly with them?
Yeah.
And you are speaking so good.
I've yet to try an apple though, you know, the crunchy, but you know, it's early days yet, isn't it? I think you'll have to give me a carrot or an apple.
Yeah.
before I
Tonight,
go.
yeah. Tonight.
In case I need another adjustment.
No, tonight, yeah.
Yeah, I've had two adjustments, haven't I, so far to the denture. So I've been here. Well, I fly home again on the 26th of this month. So I've been here just over 2 months. So yeah, it's been a journey.
It's been a journey, yeah.
Isn't it?
Yeah.
And you know, I've met Dr. Dev's children. It's just, and he's got to know now that I like chai tea as well. And I'd get a message saying, tea? Yes, please. You don't have to ask. But yeah, you know, I just want to say thank you because, you know, thank you very much to you and all your family and all your staff. You know what I mean? Just so lovely. Thank you.
So I would just remind you that keep doing the yoga practices you have learned here, all the meditation
My
you have
meditation,
learned.
the yoga. I've got to do those 12 asanas now. And my breathing.
Yeah, all the breathing practices.
My breathing. Yeah.
Yeah.
Have I got to say anything else here? I think I'm just trying to make sure I've said everything that I wanted to. I need to mention Rajni as well because she's been excellent.
The acupressure things you have.
She comes and does the acupressure to my room, and I've had a massage most days, and she's very skilled because she does acupressure. She can do cupping and all things, and she's very much into the Ayurvedic stuff as well, as Dr. Dev does that as well. So yeah, it's just wonderful. It's great. I just think I want to take them all home with me now because how am I going to cope? The cook, the massage, yoga instructor. No, it's great. So thank you.
Thank you very much.
Yeah, thank you.